So today, Rick is going to consider trying to make the area around the eyes a little bit more youthful and less tired looking without surgery. And we can do that to a certain degree. So if you look here, what's changing versus when you were 20? Well, you're not as full, so you can't underestimate the loss of volume here. Because if you look at young people, they're typically full. And as we lose the fullness, our eye catches that loss of volume and registers older. So this goes with what Rick originally came in with, which is the ring around the eye. And this is a great example of the fact that around the eye, there's many things going on, and I'll just kind of go through them with you, Rick. Number one, if you look in the mirror, I hope you can see, the darkness of the skin here versus the light color here is really hard to fix. I mean, you can do chemical peels, you can do whitening creams, but that's a genetic change that's hard to make go away, and it contributes to the loss of volume in the ring or the hollowness that you see. Because the light hits the bulge, which is the fatty tissue, and casts even more of a shadow in addition to the dark skin. So the dark skin is hard to treat, but the loss of volume in that hollow, that we call it the kind of a tear trough, that trough where the loss of volume starts showing your orbit in your bone, we can fill that with a product. We usually use something like a hyaluronic acid because it's safe, it's been around for years. You can dissolve it if there's any irregularity. So it's reversible, and it usually lasts up to a year and a half. Okay. You don't typically come back and have it completely done again. You may need a touch-up. And we're very conservative. I'd rather you come back in a couple of weeks and say, well, I think I need more than to overfill, even though you can dissolve it. So what I would recommend, if you look in the mirror, is putting the filler right along the hollow or the tear trough, and then putting a little bit here just to give you a little fullness there, because it all goes together. And that's what I would do. All right. Okay. And so again, it's not the same as doing, a surgical procedure where you pull the skin up, but you still haven't fixed the hollowness even if you pull the skin up. So in your case, we're treating the reason for the changes, which is loss of volume. And the way we do this, and we'll talk about it in a minute, is we use a blunt needle, a blunt hollow needle to gently fill there, because you have to be cautious around the eye. If you use a sharp needle and you put much pressure on it, it can go to one of the little capillaries or arteries that go to the back of your eye, and there's reports of blindness. So we're very cautious and very intentional when we inject around the eye. And I tell everybody that, not to scare them, but just to let them know that's the reality. Blindness by fillers around the eye are reported all over the world, and we kind of know how it works, but we're still very cautious there. I'm going to start marking you, Rick. So we're going to put just a drop of the Juvederm right on top of the bone there to fill this part, and then in this tear trough we'll use the Restylane to just gently try and make that less noticeable. We're not trying to completely fill it, because you also have to know when you smile, you have to make sure it's not going to look funny when you smile. So it may look perfect if you fill it when you're not smiling, and then when you smile you have an unusual bulge. Right. So you have to look at it both in static appearance and dynamic. And that's why sometimes you'll see it and go, well, I thought you could use more, but then when you smile it'll look funny. So that's why the filler only does so much. I'm going to mark you over here. And again, that's where we're putting it down deep on the bone to fill that in. And then we're using it very much right under the muscle of the eye in the tear trough. So the Restylane goes there, and the Juvederm, the deeper product, goes right on top of the bone there. So Rick, we're starting with a little drop of local anesthesia in the skin, because we make one little tiny needle stick, take the needle out, and then thread the plastic needle. So we're making sure you don't feel the needle stick except for the local. And we use a little cold spray just for comfort. Maybe close your eye. So here comes a little cold spray. Just makes the tiny needle stick less noticeable. And here comes just a drop of local anesthetic, okay? A little pinch, we're knocking on your face here. And this just makes it numb where we're going to put the local. And I know you're feeling a little burning there. That's just the local going in. Hopefully that's not too bad. Most of us men are all wimps, just the way it is. So we're used to that. So we treat men a little bit differently. We're a little more hand holding. They need it. Most of us men need it. Great, thank you. And a little pinch here, Rick, okay? Pinch right there. Okay, we're cleaning up again. Now we've made this area numb, and we're going to make a tiny little needle stick so we can thread our blunt needle in there. And you shouldn't have any discomfort here. A little pinch there. So that just makes our little pilot hole comfortable. Yeah. Okay, good. And now we'll take this blunt needle and we will start threading it in that area. So you can see it glides underneath the skin. Now, Rick, this feels weird, but you shouldn't feel any pain. So maybe close your eye just for a second. And it just kind of glides underneath the tissues. It feels really strange. It's going right up here where we need it to be. And again, there's a little Novocaine in this product, so you'll start getting a little numb as we go, okay? You hanging in there?
Yeah.
Probably feels like I'm coming at your eyeball. I promise I'm not. Should be getting a little bit numb now, so you shouldn't really feel as much. That easing up there? Should be a little numb there right now. I'm going to go on the outer part of the eye now. This feels weird, so hang in there with me. I'm tapping on you a little bit, okay? It takes time to do this. We're not putting a lot in anywhere. It just takes time. Just little bitty increments of filler. Going back over here for the last little bit. Again, we're just sliding right underneath everything. And the last little bit here. The alcohol sponge. We're going to do a little cleaning here. So you can see this is the local anesthetic. The filler has been put in here and here, and you can see the other side has not been treated, and you see how hollow and bony it is. Now we're going to put just a little bit more here to lift this part up right there. All right, now we're going to put just a little bit along the bone, and we're done on this side. You okay, Rick?
Yes.
Okay, great. And this is going right on top of the bone to just give a little more fullness to the cheek. Nothing that's going to be noticeable to anybody who doesn't know Rick, but certainly hopefully enough to see why we did it. Thanks, Brenda. Okay, we're done on that side. We're going to sit you up in a minute so you can see one side completely done and one not, so you get an idea of what we're trying to accomplish. Again, it's not a miracle, but it certainly gives a subtle improvement, and it's not surgery. All right, so I'm going to sit you up, Rick, for a second. So let's take that mirror for a second and then look straight in the mirror. So if you lean your head up like this, you can see you don't look that much. The darkness is still there, but the fullness here compared to the flatness there, and the ring right there is not as full. And that's all you're trying to do. And give me a big smile. Yeah, so you still look normal when you smile. That is local anesthesia. That's not filler. Okay. So that's all we're trying to accomplish. It's not a miracle, but it's better than anything else you can do. Yeah, you can see it's just not as flat as that. So I guess we better do the other side. Okay. So here we go. We're going to do this side now. Here's the tiny needle stick, Rick. So hopefully you don't have any pain there. All right, here we go on this side. Remember, it feels weird, Rick, so hang in there, okay? It feels really strange initially. And then there's Novocaine that starts making it a little bit numb. Small incremental amounts. No heavy pressure with the plunger, so there's the risk of any kind of injury to anything is very low. This is a very gentle process, very gently injecting. And hyaluronic acids are, again, something we can dissolve if we thought there was a little bulge or an irregularity. Not that we're expecting it, but it's nice to know that. Anything injected around the eye that's permanent, even though there's not that many permanent products, has some downside because you really can't remove it. The volume we're using is just a half a cc on each side. That's all we're using. It doesn't take a lot of volume. The biggest things we see are people injecting too much volume, and then they look distorted when they smile. And these little pilot holes heal, you know, you don't even see them after they're healed. And even though you didn't bruise on the other side, you certainly can have some bruising. Sometimes you don't see it for a couple of days, but it's usually pretty minimal, but you can have some bruising from this. So we always warn patients that not to have anything major scheduled for at least a couple of days, even though with men it's harder because they don't want to wear makeup. Women can usually cover it. So we filled the trough. Now we're going to fill this little crease here, and we will be done. Okay, and the last little bit, this is the deeper filler that goes right on top of the bone to fill this hollow right here. And this usually is not very uncomfortable because it's right down on the bony area. And this really does make a difference when the hollowness extends down into the cheek. Doing okay?
Mm-hmm.
Good. We're almost done. Your ordeal's almost over. Many times what we see is a wife will have something done and the husband's not really sure he wants her to do anything, and he's a little reluctant, thinks she might look a little weird, and you wind up doing something that makes them look a little better and very natural, and lo and behold, the husband might want to do something too. It's amazing how that happens so often. So men are usually reluctant to do these things because they don't want to have the stigma of having it done, and it's very understandable. So these are the kind of things that are going to fly under the radar, and most men, once they've had it done, you know, go, why didn't I do it sooner? Well, it's because you didn't know that it could look that natural. And again, all the things you see on the street that look weird are the ones that you see. The ones that have had good work, you never notice that. It goes underneath the radar. People just look a little bit better and no one knows they had anything done. So that is the goal. We're done. I'm going to get you all cleaned up. You did great. Just doing a little massage here to make sure everything's as smooth as possible. We use a little antibiotic ointment on a tiny needle stick. Most people, like I say, can probably go to dinner the same night, but we're cautious to let them know they could bruise. So what we've done here is we've filled right here for the hollow with a deeper Juvederm on the bone, and we've used Restylane in the tear trough there on both sides. And as you can see, there's still a hollow there, because now give me a big smile. If you fill it too much, it won't look normal when you smile. So you have to be cautious. This bulge right here you may see and go, wait a minute, what's that? That's local anesthesia and swelling, and that is local anesthesia and swelling. The filler, again, is right in the hollow and then the deeper part there. So I'm going to sit you up. Rick, you did great. You're a great patient. So if you hold that up, you can see. Again, that's probably going to be a little bruised. There's also blue or purple marker there. And again, that's swelling from local. And that's swelling from, yeah, that looks really good. So what we've done is we've taken filler to try and rejuvenate the area around the eye. And so what we've done is we've taken Restylane and we've filled that ring, that hollow, and we've put a little Juvederm, which is a deeper hyaluronic acid, right on the bone to bring this forward. So again, if it wasn't for a little bruising and a little purple marker, you could probably go to dinner tonight and no one would know you did this. And if you smile real big, you can see there's nothing unusual when you smile. Again, that's local anesthesia there. That's not filler. It's that little bulge. So, you know, I think you've done about as much as you can do. You might look in the mirror in a few days and say, well, we could have put more here, and you can, but you got to be so cautious you look normal when you smile. So thank you very much.
Thank you.
Absolutely.